With the patient's health history in mind and proper observation of hygiene, you are now ready for the examination. First, we will do the examination of the head. Stand beside or behind the seated patient. Inspect the hair, taking note of color, quantity, and distribution of the hair. Palpate to know the texture and moisture of the hair. To inspect the scalp, part the hair in several places and examine the scalp for skin lesions and lice. There may be scars, scales, masses, and etc. Inspect and palpate the cranium to describe its size, shape, and symmetry. Inspect the temporal fossa if visible and describe if it's tortuous or not. If not, place your finger over it and describe the amplitude and equality of pulsations and consistency of wall. Examination of the face. Stand or sit in front of the patient. Inspect the face to assess the skin, noting of its color and presence of lesions. If there are any, describe its type, color changes, and distribution. Note also the shape and symmetry of the face. Observe facial expression and involuntary facial movements.
Good morning, sir. Today, we're gonna test for your visual acuity. So, sir, do you wear glasses? No? Okay. So, sir, I want you to cover your eye when you're using this cardboard, and I want you to read the top letter here in this literature. So, I want you to read this first. E, F, P, D, O, Z, L, P, E, D, okay. P, E, C, F, G, okay. E, D, F, C, Z, P. Okay, so, sir, I want you to repeat the same step with not covering your other eye. So, we're gonna start here. E, F, P, D, O, Z, L, P, E, D, P, E, C, F, Z, E, D, F, C, Z, P. Okay, sir. First, and please tell me now if you see them. Okay, so I'm gonna start. Now. Now, sir, we're gonna check for your lower lids and for your conjunctiva. So, sir, I will be pulling down your lower lids and I want you to look up, sir. So, sir, we're gonna check for your pupillary light reaction. Next, we're gonna check for your extraocular movement. So please follow the tip of my pen light. Okay. So next, we're gonna check for convergence. So please follow the tip of my pen light. Okay, sir. So now, please look straight ahead over my shoulder. Good morning, sir. Today we are going to examine your ear. Sir, I'm going to pull on your ear up and down and tell me if you feel any pain or tenderness. Did you feel any pain, sir? No. Now I'm going to palpate the back of your ear and tell me again if you feel any pain or tenderness. Did you feel any pain or tenderness?
No.
Thank you, sir. Now, sir, I'm going to take a look inside your ear. I'm going to pull on it slightly and I'm going to look inside with my otoscope. Okay? And now we are going to test your hearing. I'm going to cover your other ear with my finger and I'm going to whisper some words or phrases and I want you to repeat them if you hear it, okay? Riyuan. Okay, now let's do it on the other side. Riyuan. Thank you, sir. Sir, now we're going to compare the hearing from your left and right ear. I'm going to strike this tuning fork to make a sound or vibration and I'm going to put it on top of your head. Then tell me where do you hear the sound best, left or right or in the midline, okay? In the midline. Thank you. Now, sir, we are going to test your ear individually. I'm going to make a sound with this tuning fork and place it on the back of your ear and tell me when the sound stops. After then, I will put the tuning fork near your ear and tell me when the sound stops. The sound stops. The sound is gone. Now we're going to do the same for your other ear. The sound is gone. The sound stopped. Good morning, sir. Now we're going to examine your nose and your sinuses. Sir, I'm going to press on your cheeks and on top of your forehead and tell me if you feel any pain or tenderness, okay? Did you feel any pain or tenderness? No. Okay. Now I'm going to examine the underside of your nose. Now I'm going to use this to see inside your nose, okay?
This video covers the examination of the mouth. The examiner already washed her hands, introduced herself to the patient, and obtained their consent. For the examination of the oral cavity, a good light source is needed. You can use a head mirror or a pen light. In our demonstration, we use a pen light. Second are the tongue depressors, which are disposable, thin, wooden blades, smooth and rounded at both ends, similar to the appearance of popsicle sticks. And lastly, a pair of gloves. For the examination of the lips, observe their color and moisture, and note any lumps, ulcers, cracking, and scaliness. For the inner surface of the lips, hold the tongue blade on the left and the pen light on the right. Retract them with the tongue blade where the teeth are approximated. Again, inspect for its color, moisture, lesions such as fissures, ulcers, cracks and scales, symmetry and deformities. Inspect the buccal mucosa for color, pigmentation, ulcers, white patches, and nodules. For the examination of gums, observe for color, which is normally pink, swelling, bleeding, retraction or recession of the gingival margins, pus in margins, and presence of lead, thin as black line, and bismuth lines. For the examination of the teeth, note for the number of missing teeth, state of dental hygiene, presence of caries, discoloration, fillings, ridges, and use of dentures. For the examination of the roof and floor of the mouth, observe for color, deformities, and any lesions and masses. Take note of any smell coming from the oral cavity. Note for the smell of alcohol, such as in alcohol intoxication, ammonia, seen in uremia, sweetish fruity odor of acetone, as seen in ketosis, particularly in diabetic patients, musky odor for those who have severe parenchymal liver disease, and halitosis or fetor oris due to the poor oral hygiene. For the examination of the tongue, ask the patient to protrude his tongue and describe the size, color and texture, surface, moisture, symmetry, lesions, and tremors. Wearing gloves, grasp the tip of the tongue with square gauze and gently pull it to the patient's gland. Inspect the side of the tongue and reverse the procedure for the other side. Palpate any lesion or induration for both sides of the tongue. With the patient's mouth open but the tongue not protruded, ask the patient to say ah. Note the rise of the soft palate by testing the 10th cranial nerve. Inspect the soft palate, uvula, anterior and posterior tonsillar pillars, tonsils, and the posterior apparent. Note their color and symmetry, and any evidence of exudate, swelling, ulceration, or tonsillar enlargement. If possible, albeit any suspicious area for induration or tenderness. You can also test for the gag reflex.
Good morning, patient. So here I am. I'm going to examine your neck. So please raise your neck upwards. Okay, next. I'm going to palpate your neck and then for your lymph nodes. So I'm going to use my fingers, the pads of my fingers to palpate your lymph nodes, okay? Okay, thank you, sir. Okay, next, I'm going to palpate your trachea. Okay, and inspect your trachea as well. Okay, so I'm going to palpate your trachea now. Okay, good. Okay, next, so I'm going to inspect your thyroid gland. But before that, I'm going to let you sip some water, okay? Right here. So just swallow it. But don't swallow it first, okay? I'm going to give you a go signal for that. So I'm going to inspect first your trachea, okay, your cricoid cartilage, and then your thyroid gland. Okay, now swallow it. Okay, good. Okay, I'm going to inspect your trachea and palpate your trachea, thyroid, and then your thyroid gland, and then your cricoid cartilage. Okay, so let me begin the palpation. Okay, so just hold this bottle of water for a while, and then I'm going to instruct you to sip some water after I told you to do so. Okay? Okay. I'm going to palpate first, so please stand by. Okay, so sip some water. Swallow it. Okay, good. Okay, so for the last part, I'm going to auscultate your neck. Okay, so I'm going to use the stethoscope to inspect some abnormal sounds if there are any. Okay, good. Now we're done with the test. Thank you for your cooperation, sir.